So let me summarize what you heard in this last hour from members across our country who are terrified, frankly, that this plan, Trump Care, the pay more, get less plan, the broken promises plan might actually pass. We have to make sure that it does not pass. So in summary, Trump Care strips health care coverage from 24 million Americans. It cuts $880 billion, that's almost $1 trillion, cuts $880 billion from Medicaid expansion, and it gives $600 billion in tax breaks to the wealthiest Americans and corporations while cutting benefits for seniors, working families, and the most vulnerable among us. Frankly, we don't know everything it does because there have been amendments after amendments that have been passed today. We still don't know what the full impact of this bill is, and yet they're pushing through a vote tomorrow if they can get enough votes to pass it. Trump Care is going to raise costs of health care by about $14,000 for those between the ages of 50 and 64. That's the age tax you've heard about on the floor tonight. And it's going to raise premiums for almost everyone. It puts a 30% penalty for getting health care to anyone who suffers any kind of a catastrophic event that throws you off of health care. You lose your job, and somehow you end up without health care for a couple of months, you're going to have to pay 30% more in order to get your health care back. And you heard from Representative Kennedy about mental health. You heard from Representative Eleanor Holmes Norton about work requirements. And that's just a piece of what this Trump Care bill does. And so tomorrow, I will join my Democratic colleagues and hopefully enough Republican colleagues who know that our job is to make sure we provide health care for everyone across this country. Tomorrow, I will vote no. I will vote no for the 24 million people who will lose their coverage. I will vote no for the almost 15 million people who will lose their coverage under Medicaid expansion alone. I will vote no for the millions of low-income women who rely on services from Planned Parenthood. I will vote no for the tens of thousands of people who will literally die each year if the Republicans succeed in repealing the health care that we have now. Let's be clear that the Republican majority has been passing legislation and voting to repeal the Affordable Care Act for 7 years, and yet they could not come up with a plan that would, in fact, do what they promised, which is to make sure that we're covering more Americans at lower prices. This is not, as my friend Representative Raskin said, this is not a health care plan. A health care plan would cover more people. This is a tax plan to take the benefits that working families were receiving on health care coverage across the country and convert it into tax benefits for the wealthiest, $600 billion in tax benefits. And people around the country are calling in to say, if you care about the American people and if you care about providing health care for all of us, this is a bad plan. You should not vote for it. And Republicans are hopefully listening to constituents across the country, to their governors in Republican states, Republican governors who have said how much Medicaid expansion has helped their states. They have asked and pleaded for people to keep what we have, to make it better, yes, but not to strip $880 billion away. And just recently, Paul Ryan was quoted, the Speaker of our House is quoted as saying that he's been dreaming about yanking health care away from the people who need it the most since he was, quote, drinking at a keg. This is what he said. He said, so Medicaid, sending it back to the states, capping its growth rate, we've been dreaming of this since I've been around, since you and I were drinking at the keg. Well, I don't know what he was thinking about when he was drinking at the keg, but I can tell you that what we have been dreaming about as Democrats, as people who care about the health care across this country, is that we cover people, that we don't put anyone in a position where they are one health care crisis away from bankruptcy, that we make sure that kids can get asthma inhalers, that we make sure that grandma and grandpa can go into the nursing home and get the care that they need. Because if we pass this bill tomorrow, those grandparents are not going to have the care that they need. Nursing homes are going to shut down. We're going to take away jobs from rural areas, rural hospitals across this country. And so, Mr. Speaker, today, as we close this Progressive Caucus special order hour, I'd like to say to my colleagues on the other side of the aisle, I believe we all have the interests of the American people at heart, and if we do, then I hope we will stop this Trump care bill from moving forward tomorrow. I yield back.